Amanda, and I'll be your SLP today. Can I see your wristband really quick? And can you tell me your first and last name and date of birth, please?
Stephanie Morrison, June 1999.
Okay, perfect. So your doctor has asked me to do a swallowing screening for you today, Stephanie. It sounds like you might be having some difficulty. I've checked your chart and I see that you don't have any respiratory problems, but you do have Parkinson's disease, is that correct?
Yes.
Okay. I've also checked with your nurse. I've let her know that we're doing this screening today, and I've made sure you don't have any other procedures that you're awaiting, so you are allowed to eat and drink for this evaluation. If at any point during my exam I need to touch your head, neck, or shoulders, is that okay?
Mm-hmm.
All right, wonderful. I see you're sitting up straight, you have your feet flat on the floor, and your legs are uncrossed, so I'm going to ask you to remain that way throughout the evaluation. I've looked over your EAT-10 score, your questionnaire that you filled out, and you have a score of 18, which is higher than the concern score of 3. So just a couple of questions. Are there any foods that you avoid or that your doctor has asked you to avoid?
Just I eat soft foods.
You eat soft foods. Do you prepare your food in any special way?
I cook it.
Okay, so you just cook it, make sure it's nice and soft. Okay. Patient reports a diet that's consistent with a voice score of 5. I see that you're alert and cooperative today. You can answer all my questions, and you're breathing through your nose at a normal rate. So first, before we start the swallowing, I'm going to assess your speech, language, and voice. So please repeat these words and phrases. Chair.
Chair.
Ball.
Ball.
The father comes home.
The father comes home.
He picks up the paper from the coffee table.
Picks up the paper from the coffee table.
Wonderful. And can you name these 2 objects for me, please?
House. Tree.
Wonderful. Point to your nose for me, please, and point to your ear. Is 1 pound of sugar heavier than 2?
No.
Can you write a letter with a pen?
Yes.
All right. Language expression and comprehension appear to be within normal limits. So now we're going to test your phonation time. I'm going to go ahead and put my gloves on because I don't need to touch your face yet, but we'll just make sure the sanitizer gets dried. So first I'm going to have you take a nice deep breath and hold out an ah for as long as you can, whenever you're ready. Okay. And now we're going to do the same thing, but instead of one pitch, we're going to go up and then down. So it'll sound like ah, okay? All right. So next, while I'm putting on my gloves here, I'm going to have you take a nice deep breath and say the S sound, so S, for as long as fast as possible. Okay, let me find some gloves here. And now we're going to do the same thing, but with Z. All right. So next, once I get my gloves on, I'm going to have you say a couple of sounds as many times as you can, as fast as you can, okay? The first one is pa-pa-pa, and ta-ta-ta, and ka-ka-ka. Okay, so now we're going to combine those sounds together, and it's going to sound like pa-ta-ka. Okay. So next I'm going to test the feeling in your face and your mouth and jaw movement, okay? So I'm going to have you close your eyes, and I'm going to lightly touch your face. Can you feel that?
Mm-hmm.
Can you feel that?
Mm-hmm.
Are they the same on both sides?
Mm-hmm.
Okay, can you feel that?
Mm-hmm.
Can you feel that? Are they the same on both sides?
Mm-hmm.
And can you feel that?
Mm-hmm.
Can you feel that?
Mm-hmm.
Were they the same on both sides?
Mm-hmm.
All right, so I'm going to have you, next, you can open your eyes, and I'm going to have you open and close your jaw for me. And wiggle your jaw side to side. And bite down. I'm going to feel your cheek muscles. Wonderful. So now I'm going to have you keep your mouth closed, and I'm going to try to open it, but don't let me. Oh, okay, I'll try. That's okay. I'll try to close it too. I got to do that anyway. So keep it closed. I'll try to open it. Don't let me. Now open it, and I'll try to close it. Don't let me. Okay, now keep it open. I'm going to try to move it side to side. Don't let me. To the right, to the left. And I'm going to test your jaw jerk reflex here. All right. So the next thing is we're going to test some of the muscles in your face. So I'm going to have you open your eyes as wide as you can for me, and I'm going to try to close them. Don't let me. And now close them as tight as you can, and I'm going to try to open them. Don't let me. Okay? Go ahead and open your eyes. And then I'm going to have you puff out your cheeks like a frog. There you go. And I'm gonna try to push out the air, but don't let me. All right, you can go ahead and let out the air. So I'm gonna grab my tongue depressor here. And while I'm getting this open, I'm gonna have you smile really big for me and pucker your lips and go ew, ew, like an ambulance. All right. So I'm gonna have you hold this between your lips and I'm gonna try to pull, but don't let me. All right, you can let go now, thank you. So the next thing I'm gonna have you do is stick out your tongue as far as you can and point the tip up towards the sky and down towards your chin and wiggle it side to side. All right, wonderful. So go ahead and stick that out nice and far. And I'm gonna try to push it to the right, don't let me, and to the left, don't let me. And I'm gonna try to push it into your mouth, don't let me. Wonderful. So have you noticed any changes in your voice recently?
It's been really soft, maybe my Parkinson.
Okay, so it's just really soft. I'm gonna test your gag reflex quick, so let me grab my light so I don't poke you in the wrong spot. Go ahead and open up your mouth, and I'll test on the right and on the left. Wonderful. So now I'm gonna set this down for just a second on my tray, and go ahead and open your mouth back up and go ah, and now go ah 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 ah. Okay. Now I'm gonna take a mirror and hold it under your nose. Ooh, that blinded me. And say ka ka ka.
Ka ka ka.
Perfect. So the patient has good facial symmetry. There's no uvula deviation. Her lip strength and closure appears good. She has good facial sensation and good muscle strength in the face and tongue. And her mucosa color was within normal limits, and she has good oral cleaning. So now, I'm gonna stand over here, and I'm gonna put my fingers right here on your neck, and I'm just gonna ask you to swallow your saliva for me. All right, and now show me a good cough. Wonderful. And hold your breath for 5 seconds, please. All right, patient shows good ability to coordinate breathing and swallow, and she swallowed on an expiratory pattern. So now we're ready to start some bolus trials here. We're gonna start with 1/2 teaspoon of thin liquid, which is level 0. So I'm gonna hand you this spoon, and then when you're ready, go ahead and swallow it, and then after you swallow, say ah. All right, thank you. I'm gonna do that again. 1/2 teaspoon thin liquid level 0, and swallow and say ah. Okay, now we're gonna move up to a full teaspoon of the same thin liquid level 0. There you go, I'll hold the cup under it so it doesn't splash you. And whenever you're ready, swallow and say ah. Okay, we're gonna do that same thing again. 1 teaspoon thin liquid level 0. And swallow and say ah. Perfect. Now we have a cup with 5 milliliters, same thin liquid level 0. I'm gonna hand you that. And whenever you're ready, go ahead and swallow all that and then say ah. All right, I'll put 5 more milliliters in that. Or milliliters, sorry. And same thing again. Swallow and say ah. Wonderful. Okay. So now I'm going to give you the whole cup here, but you're not going to drink the whole cup. We're going to move on to a natural sip of thin liquid level 0. So whenever you're ready, go ahead and take 1 sip, swallow and say ah. All right, and the same thing again. 1 sip, swallow, and then ah. Beautiful. Okay, we're going to move on to puree, which is level 4. This is applesauce. So we're going to start with 1 teaspoon of puree. Try not to make a mess. And we're going to do the same thing. So whenever you're ready, swallow and say ah. All right, and then I'm going to take a peek in your mouth, make sure there's no residue. Awesome, wonderful. Okay, can I have your spoon back, please? Thank you. We're going to do that trial again. 1 teaspoon puree level 4. And go ahead and swallow and then say ah and let me see. Okay, let me see. Wonderful, there's no residue. So we're going to move on to a cookie, and I can take your spoon. So we have a piece of cookie here, and we're gonna do something pretty similar. So with this one, you're gonna chew it first, but then right before you get ready to swallow, open your mouth and let me see, and then we'll do the swallow trial, okay? So go ahead and chew. Okay, and there's still a couple big chunks in there, so go ahead and chew just a little bit more and then let me see again. All right, that looks much better. So I'm gonna put my hands down here, and then whenever you're ready, swallow and then say, oh, cough, 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 and swallow again. All right, you okay? Okay, let's take another sip and rinse your mouth and swallow. Okay, can you say ah for me? Okay, does that feel better? Okay, so we're gonna try that again, but then right after you swallow your bite of cookie, I want you to just take a sip right away, okay? And then after you, I don't know, I'll give you the cup in this hand. And then after, oops, cookie broke. Okay, so you're gonna chew, let me see, swallow, and then take a sip, and then say ah, okay? It's kind of a long step, but go ahead and chew and let me see. All right, it looks good, so I'm gonna go ahead and put my hands up here, and whenever you're ready, swallow, take a sip, say ah. Wonderful. Okay. The patient exhibited no trouble with thin liquid level 0 or puree level 4. However, she did exhibit some difficulty swallowing the solid level 7, and we used a rinse and re-swallow strategy to remedy that. So, what this means for you is, for now, I'm going to have you avoid solids. You can go ahead and stay on your soft foods diet because you didn't have any problems there. The problem with solids right now is it sounded like some of it could be getting into your airway when you swallow, and that can lead to pneumonia, so we're going to avoid that for right now. I'll report to your doctor and nurse the results of your evaluation, and I'm going to recommend you for a fluoroscopy study so we can see what's happening on the inside while you swallow. Do you have any questions for me? Excellent. C.